Yes.
Yes.
Okay. So we will start with the aortic valve stenosis. But before going through the pathology of the aortic valve, let's review some anatomic landmarks. And let's remember that the aortic valve complex, in this image you can see the aortic valve complex is a bridge between the outflow tract of the left ventricle and the ascending aorta. The aortic root, this is the aortic root. We have the sinuses of Valsalva here and here, is the direct continuation of the left ventricular outflow tract. So the LVOT is continued by the aortic root. Within the aortic root, the semilunar leaflets, and these are the leaflets, are attached throughout the length of the root and supported in a crown-like fashion within the cylindrical root. This is a cut through the aortic ascending aorta and the aortic root. It's a transversal cut. The main features of the aortic valve complex are the three semilunar leaflets. Here you can see only two of them. You can see the right leaflet and the left leaflet. We have three sinuses of Valsalva. Each sinus corresponds to one semilunar leaflet and the so-called aortic annulus. This is the diameter of the aortic annulus. Here you can see the three semilunar leaflets and the sinuses of Valsalva. So each leaflet is associated with a small dilation of the ascending aorta, referred to as sinus of Valsalva. The sinuses are named after the coronary arteries originating from them, right, left, and there is a sinus without a coronary, a corresponding coronary, which is the non-coronary sinus. The junction between each leaflet, so these are the leaflets, and ventricular structures, here is the ventricle, so the semilunar leaflets and the ventricular structures, the junction marks the anatomic ventriculo-arterial junction. The annulus of the aortic valve is not a true ring, but it is a virtual ring formed by the attachment points of the leaflets within the left ventricle. These are the attachment points here, here, and here, and connecting these attachment points, we will get the so-called aortic valve annulus. In this image, you can see the aortic valve morphology. This is the normal aortic valve morphology, including the three leaflets. The aortic valve has normally three leaflets, but sometimes we can, in some patients, we can find pathological morphologies. And in this case, for instance, you can see only two leaflets. Sorry, this is a bicuspid aortic valve, one here and the other one here, with a slit, with a linear slit between the two leaflets. Leaflets, another pathological variant